Good morning and welcome to the press conference in the National Press Theatre. I'm Elizabeth Thompson, and with us today we have new Democratic MPs Megan Leslie and Carol Hughes, as well as Tim Wall from the Canadian Association for Suicide Prevention and Marion Wright, Chief Executive Officer for the Canadian Mental Health Association. Bonjour et bienvenue à cette conférence de presse. On a avec nous aujourd'hui les membres du Parlement de le Parti Nouveau Démocratique, Megan Leslie et Carol Hughes, aussi Monsieur Tim Wall de l'Association canadienne pour la prévention du suicide et Madame Marion Wright, présidente directrice générale de l'Association canadienne pour la santé mentale à Ottawa. If you'd like to proceed.
Thank you. Merci. Thank you very much for joining us today as we talk about this bill that we're about to introduce in the House tomorrow, a bill that would see a strategy, a pan-Canadian strategy for suicide prevention. Suicide is a concern for our communities, but in reality, this is a national issue. The long-term effects are very significant when a family member or a friend takes their own life, and the loss tears at the fabric of our communities. It's a reflection of the lack of supports and services for that individual and an understanding of what the underlying factors were in that person's life. As we know, no community in Canada goes untouched by suicide, and no community is not in need of addressing the stigma related to suicide, depression, addiction, and mental health. No community is free from bullying, from discrimination or marginalization, from the crippling consequences of financial ruin, from marital breakdown, and the perception that the future is bleak, particularly in remote communities. Over 3,500 people in Canada die by suicide every year, and suicide is the third leading cause of death among adults aged 25 to 49 years of age in Canada. It's the second leading cause of death amongst teens and adults between the age of 10 and 24. But suicide is a preventable issue when we tackle it at an interpersonal level, but when we also tackle it at the community level. And we're doing this across Canada. We have the tools to prevent suicide in Canada, in our communities. What we need is a pan-Canadian strategy, that would link and coordinate these best practices around Canada. Australia, New Zealand, the UK, the US, these countries have suicide prevention strategies, and Canada has fallen behind on this issue. It's proven in the numbers, very sadly, because Canada does have a higher suicide rate than the UK or the United States. The Government of Canada has stated in the past that the Mental Health Commission framework covers suicide prevention, but their 2009 report only very briefly touches on the issue of suicide. A national strategy is needed to specifically address suicide as an issue separate from mental health. So I'm very proud to announce the tabling of the bill for a national suicide prevention strategy. It will be seconded by Madame Hughes. Pardon me. Our plan is to introduce this bill tomorrow, and it would call for a national strategy, a strategy that would include things like national guidelines for best practices, the use of community and culture-based knowledge in prevention, and an assessment of the current services as well as the gaps. With that, a little introduction of the bill, I would like to turn the table to Tim Wall, the Executive Director of CASP, the Canadian Association of Suicide Prevention, to talk about his experiences on the ground and why we need the federal government to act now when it comes to suicide prevention. Tim?
Thank you. Like H1N1, SARS, and AIDS, suicide is another Canadian pandemic. However, it is one that is often not talked about publicly and is frequently shrouded by secrecy, shame, and stigma. This year, as in years past, more people will die by suicide in Canada than the number of all injury-related fatalities and homicides combined. Over 3 million Canadians have known the pain and sorrow of suicide. Suicide is a major public health and social issue, and yet Canada has not responded to both the United Nations and the World Health Organization's call to action, and joined the international family of countries who did, and established national suicide prevention strategies and funded national coordinating bodies. Suicide is complex. It is a national tragedy. It is preventable, and there is hope. We know what to do, and by working together, we can save lives and prevent more families from being torn apart. Suicide affects us all. Suicide prevention crosses all party lines and jurisdictions. Suicide prevention is each person's, every community, every province and territories, every elected public official, the media, and the Government of Canada's responsibility. Keeping hope alive and saving lives will require that we all share that responsibility, the burden, the cost, and in the commitment. Moving forward on a national suicide prevention strategy is a good place to start in ensuring we are all part of this important national conversation, and that we are all doing our fair share, including the Government of Canada. This strategy will bring us together, unites us in a common cause, and demonstrates both leadership and compassion. We cannot afford to wait any longer. The cost is too high and unbearable. We are talking about our brothers and sisters, our children, our parents, our students, our co-workers, our friends, and the people that we walk by and pass on the street every day. The Canadian Association for Suicide Prevention is committed to working with all our political parties and the Government of Canada to ensure that Canada no longer stands alone, and that the Government of Canada stands alongside the communities across our country who are trying to so desperately make a difference. This bill gives us hope, and we hope that next September the 10th, on World Suicide Prevention Day, we will be able to say to all Canadians and the rest of the world that Canada finally has a national suicide prevention strategy, and that the Government of Canada is funding efforts to promote coordination of suicide prevention in Canada, facilitating communication, public awareness, and the exchange of knowledge and ideas across this country. Thank you.
Thank you, Tim. And this bill really is about keeping hope alive, as Tim said. I'd like to pass it now to Marion Wright. Marion is the Executive Officer, the CEO of the Canadian Mental Health Association here in Ottawa. Marion?
Thank you, Megan. Good morning. I am here today to speak in strong support for a national strategy for suicide prevention in Canada. The need to mobilize policies and services and to, most importantly, affect public attitudes towards suicide and its prevention in Canada. This is a critical and important public health issue for us all. Death by suicide for any Canadian is tragic, yet daily, Canadian citizens commit suicide. In fact, 10 Canadians will die today by suicide. 10 Canadians will die tomorrow by suicide, and such for the rest of this year. Suicide is the second highest cause of death among Canadians aged 10 to 24. That is 10. These are children. The suicide rate for Canadians, as measured by the World Health Organization, is 15 per 100,000 people for Canadians. But the suicide rate for Inuit people living in northern Canada is about 65 per 100,000 individuals. A national strategy for suicide prevention might include the creation of a national network of best practice in suicide prevention, and also support for those who contemplate suicide, as every 6 minutes someone in Canada will be contemplating suicide, or are bereaved by the death of a loved one by suicide. A review of the funding arrangements to provide treatment, education, and professional training and other supports to prevent suicide and to assist those who are bereaved by death from suicide. A national strategy might also include how we might use community and culturally based knowledge to prevent suicide and to reduce the stigma that is often associated with mental illness, addiction, and marginalized individuals. And finally, a national strategy might provide us with a means to coordinate activities across the country for suicide prevention. By creating a framework, we could work together across Canada to prevent death by suicide and reduce the stigma that's often associated and is a barrier for individuals in seeking assistance when they have suicidal ideation. And again, every 6 minutes, somebody in Canada will be thinking of committing suicide. And every day in Canada, 10 Canadians will complete suicide and die by suicide. We are calling on the Health Minister to convene a meeting with the provinces and the territories to move on a national strategy for suicide prevention.